In the era of genomics, where uh, we are looking at a sector which is going to define and personalize the healthcare for the healthcare seekers, we have with us two eminent founders of a company called MedGenome. We have with us Mahesh Pratapneni, who's the co-founder of MedGenome. He's also the board member. He is known for building outstanding global teams and comes with broad experience in product visualization, development, management, and building global delivery models. Welcome, Mahesh. We also have with us Dr. V.L. Ramprasad, who is the CEO of MedGenome. He's a scientist with several peer-reviewed publications to his credit. He has been with MedGenome since the inception and spearheads the operations and the strategy for MedGenome. Welcome. So let me ask you my first question, which is very pointed towards Mahesh, who's founded this company. Can you tell me the journey in genomics and the growth of this industry and what attracted you to this particular space?
Sure, Harvinder. Thanks. Genomics is a new field in healthcare. So Sam Santosh and I founded this company. Very early on, we were both in software. We used to run software companies. I was CIO for bank, etc. And we saw that with the mapping of genome, there was a new opportunity for technologists to come into the field of biology and join hands with biologists to come up with new solutions for diagnostics and potentially discovery of new therapeutics. The big thing that attracted us at that time was, one was that it was based out of data analytics, algorithms, etc. Two, it was a very, very large unmet need. So all the genetic tests that we do in the MedGenome does today, they are not replacement tests. These families would not have anywhere else to go but for the tests that we do. So we started incubating this company 2008-9 timeframe, and 2013 is when MedGenome was launched. At that time, even doctors, clinicians in India were not really aware of the potential of genomics, or the costs were so high that they wouldn't consider it. So MedGenome ended up making the market aware. We would do continuous CMEs. We did the first human reference genome for Indian population. So we would keep training people and build awareness. From that point to now, partly thanks to COVID too, that everyone is aware of what is sequencing, what is RNA, what is DNA. We have come a long way. Adoption curve has been really big.
So, Dr. Ramprasad, how does genetic testing work? And it's important, like what Mahesh said, that it got its importance during the COVID. What was it that came out of COVID, which is now good for the industry?
Yeah, so to be very frank, prior to COVID and after COVID, the kind of work we do is almost the same, or similar. But the awareness has grown leaps and bounds, especially the information, the awareness among the common public is significantly different, including clinicians compared to pre-COVID and post-COVID. So what we do in genetic testing is a very, very broad question, but I can tell you simply. So there are three aspects which are addressed as a part of genetic testing. Number one, in majority of the tests that we do are primarily for illness currently. We are moving towards wellness. So that's the most important thing. Second, when we are considering illness, there are three aspects come to the mind. Either it's a patient or healthcare provider. Number one, how do I treat or better manage a patient or a disease? Number two, how do I prevent or predict this either next generation or the same individual recurring back? That's the second one. Third, or maybe the first point, is how I can diagnose this disease accurately, better accuracy. These are the three things that we address as a part of genetic testing. So depending on situation, depending on the question asked, depending on what they are looking for a solution, the tests vary, depending on disease, what we do varies. But this is a broad context of what we do for genetic testing.
There are two aspects in which the disease generates, Arvind. The one is inherited, because a lot of Indian families, the way they have evolved, there's a lot of genetic disease burden in India. So that gets inherited. Second is because we live, we accumulate lots of mutations. And that's where the tests like Dr. Ram was saying for oncology, cancer-related tests come in that, play a role there, where we can say what therapy should they go for.
How the healthcare sector is being supported and uplifted by digital technology. Can you share your opinion on that, please?
Mahesh, you want to take this?
Yeah, so like I said, we came from software, but especially genomics is all about digital technologies. If you look at the back end, and recently digital technologies are being applied in the front end to acquire customers, show them on an app what is the trend line of your data, etc. But at the heart of it, I think digital technologies do a lot of good at the science itself. So for example, when you sequence a whole genome of a single person, it will come up with 100 GB of data. From that 100 GB, how do you come down to 2 or 3 mutations which matter? So instead of doing whole genome, there are things you can do. You'll do only an exome. That'll come up with lesser data. And then there are algorithms, there are comparative databases that you have to gather. And these databases are different for different populations. So completely digital from that point of view. Now we have implemented ML algorithms. AI is being applied to certain parts of these tests, by which accuracy, ability to scale, bringing the cost down, all of that is all digital. Then, of course, go ahead, Ram.
Yeah, so very simple, Arvind, to understand this. We have 4 letters in our DNA, A, T, G, C. So these ATGCs are coded in a binary code, similar to how you store the data, the electronic data or digital data. So today, if you come to our lab, we talk biological data in terms of the binary data. Okay, so we tell, okay, we generated 3 terabases of data, 5 terabases of data, which basically means so much of ATGC we have generated. That's one part of it. So second part of it is how you process the binary data. As Mahesh mentioned, the workflows pipelines. Finally, you end up, when you sequence an individual, you're seeing COVID genome sequencing. COVID genome is 30 times smaller than human genome. Okay, so human genome is much larger one and much more complex one. So one individual, you sequence it, you get millions of variants, like how you're seeing COVID genome, delta, beta, gamma, everything. So you get here millions of variants, but the patient is getting a disease only because 1 or 2 variants. So how you would go starting from sequencing data in a digital way, converting that into binary code, and bringing it down to that few variants and interpreting and making the report is our whole workflow that happens on the digital side.
So tell me one thing, I mean, since you're talking about data and the kind of data that you're collecting is huge and is also extremely, extremely important for defining what the future is going to be, right? Now, how do you secure the data and how do you also manage the privacy of the patient? I mean, you know, for example, if I understand correctly, you may be analyzing a part of that data because of the, because you don't need that 100 GB of data, right? But that data is available to you.
Yep.
So how do you ensure the privacy of the patient and the security of that data which you've collected but may not have used right now for him?
Yeah. So 2 aspects again, operational aspects of how you keep the privacy, and second is on the statutory regulatory point of view. So when it comes to genetic testing or genomics, it's a completely different ballgame compared to what you do on a routine pathology. Okay, as you mentioned, the moment you have the data at any point, for good or bad reasons, you can always slice and dice it. Okay. Now, on the operational front, the way we report, the way we share the information is completely regulated compared to how you do your routine pathology tests. We don't share reports to anybody except the patient and the physician who referred the test. This is mandatory across the organization. We face some issues, but we are very, very diligent about it because it cannot be taken home. Even today, we spend quite a bit of a few hours in a day to get approvals from the patient, the consent written consent from the patient, even if we have to share his data or report to a third physician, which he is prescribing. So that's a kind of operational diligence that happens. It adds resources, new workflows and all, but that's a different story. Now, the systems, the digital systems, the software, the kind of IT networks, the encryption, the password security is all at a different level for us today. We accept few people who really need access to the data for making the reports. Rest of the people, the data is encrypted. It's de-identified, completely de-identified. We do not know who is the individual, what is the individual, from where he is coming from. Okay, that's the second, that's the internal process. Third, when we are working with stakeholders on a larger projects, not on a 1 or 2 patient genetic testing, it could be a population genome project, it could be a pharma companion diagnostics project or anything. 2 broad things. Unfortunately, in India, we are still not evolved to a privacy bill on the genomics side. There is a bill already tabled in Parliament on the regular data, e-commerce data and all the stuff. There is just mention of few words on genomics, but there is no very elaborate, nice, balanced regulatory thing. Since we are a company which are practically dealing with this kind of a data, on the whole, we follow the GDPR compliance, which is a general data protection rights of Europe, which is very well balanced both on industry side and protecting the patient rights of privacy. We follow that, and whenever we do larger projects, we ensure that we sign NDAs, we do an audits, internal, external audits on how the data is protected. So it's a fairly well-oiled regulatory mechanism, how it happens, but it is definitely completely different compared to what routine pathology tests are done.
So one context there, Harvinder, is that this data is unlike the e-commerce or transactional data. So that's the data when there is leakage, passwords, credit cards, there's immediate impact. And that data also needs to be kept alive all the time, kept live, right? In our case, we'll get this 100 GB or 20 GB, whatever. That doesn't need to be kept live all the time. What is needed is the insights out of it in an aggregated format. So even when we work with a pharma, we'll take 100 genomes, which might be at 10 terabytes of data, and then you derive the insights out of it. Then that data is put into cold storage. It's not live all the time, encrypted, de-identified, kept into storage, cold storage.
Got it. Now, how does the real-time genome test sequencing aids the fight of diseases like cancer, TB, or any other disease that you may be working on?
Yeah. So cancer is a very good example. How the field is moving. Field is moving very fast in especially the oncogenetic side. So there are 2 aspects that we broadly address, and it's impacting the lives across the world. Number 1, as Mahesh mentioned earlier, to identify high-risk individuals who are predisposed to some form of cancer, predominantly what we call inherited cancers, something like breast, ovarian, colorectal cancer, like that, where there is a familial segregation or familial incidence of cancer already. One of the first-degree relative could be one of the parent, one of the sibling, or running in multiple members of the family. This accounts for about anywhere between 10 to 12% of the total cancers. So these cancers, we basically identify the mutation, and we help the patient as well as the clinician to better predict, and early onset only we help them to treat it much better, save lives. In fact, you can save a lot of lives that way. Classic example being a breast cancer, breast ovarian, we do hundreds of cases every month where one of the family member has it, we identify mutation, we help the second family member, could be sister or aunt, it could be anybody, whom we tell you have it, you have to be better careful, you don't have it, be carefree about it. The second aspect about is on the treatment aspect. This is where larger impact is happening, where we call today 2 aspects. 1, targeted treatments based on exactly what genetic profile the tumor has. So for example, today, lung cancer is not treated in India without doing genetic testing. There's a set of about 8 to 10 genes. If you identify mutation in one of those genes, you give a different drug. If you don't identify, you give a different drug. So it's completely changes. And moreover, the targeted treatments based on genetic mutation, much more accurate, much effective compared to regular chemotherapy that happens or radiation that happens. Okay, so that's where larger impact is happening. Almost about 8 to 10 cancers across the world are being treated in that way. So it's a new paradigm shift that's happening. This is same thing for either you take solid tumors like what we're talking, breast ovarian, or leukemias, which are childhood blood cancers. And on other front, what we call prognostication, which may not have treatment aspect, but we can tell based on genetic profile whether the tumor is going to be aggressive, it is going to metastasize, or it is not, how it's going to be, or we can even tell after the treatment 6 months whether the disease is going to come back, relapse is going to be there or not. So these are the 3-4 different aspects, starting from predisposition to treatment and management to identifying relapse or prognostication. These are 3 major aspects that we look into.
That's for cancer, then maybe TB and cardiac risk profiling. Ram, you can.
So there are 2 again major impact. For example, tuberculosis, it's not a major problem in the Western world or developed countries, which is for us. So we have to develop our own indigenous methods for larger population. And considering the 2025 Stop TB program that government has taken initiative, we've been working some very innovative methods in the last 7 to 8 years, and we came up with a novel genome sequencing method, something analogous to COVID genome sequencing, but this is slightly different. In TB, what happens is the bigger problem with tuberculosis is with the drug resistance. So we call it as MDR TB or multi-drug resistance TB, where you keep giving the drugs, the patient never responds it, and he or she succumbs to it. So what we have done is we have developed a method where directly from the sputum sample, we just sequence a TB genome within a day, within 10 days time, and we can tell what all drugs the TB bacilli or TB bug is resistant to, and inform immediately to the healthcare practitioner. Based on that, they will give you either 2nd generation or 3rd generation drugs. And this problem, if we imbibe this kind of technologies, it will hugely, you would have seen how COVID genome sequencing had an impact, whether identifying it's a Delta variant or Kappa variant at a population surveillance level. In the same way, if you adopt such similar technologies like what we have developed or a few others are working on the tuberculosis, a larger infectious disease problems we have, it's going to benefit a lot. Same way in coronary artery disease is a different ballgame. It's a huge common problem, unlike rare diseases. There are millions of people with heart attacks happening every day. Young onset heart attack is the biggest problem today. We have seen celebrities, we have seen hospitals with so many people. So we have come up, in fact, it's validated. We published in one of the largest journal in cardiology, American Journal of Cardiology, that we use a machine learning approach, and we use our large data approach, where using a very simple 5,000 rupee test, we can identify high risk individuals. It's not 100% sensitive, but it's a very nice screen tool. Identify individuals who can be high risk for young onset heart attack. So these are all different flavors of how genomic testing can help in healthcare.
And genomic testing is, like I said, it provides a new angle. So somebody who has high genetic risk will have a high genetic risk irrespective of their lipid profile.
Got it. So I think we are moving towards a scenario where you could have personalized medication given to you depending on what will work on you and what may not work on you.
Yes.
Awesome.
And your genetic makeup, which you test only once in your lifetime.
Yeah.
Correct.
Because that's same forever. Yeah.
Got it. Got it. So tell me, what are some of the insights that genetic testing provides that helps you in accurate diagnosis, targeted treatment, or for that matter, hereditary risk assessment of diseases?
If you're looking at
maybe you can talk about carrier screening is a great example. Yeah. Go ahead.
So one simple example, as Mahesh mentioned, we do a screening called carrier screening, which is a genetic test. In India and across the world broadly, we have about 30% of genetic diseases, which we call recessive diseases. Okay, so basically they come because 50% genetic defect is there in one spouse and 50% in another partner. Okay, and when they have a child together, the 50% comes, it has 100% the child gets disease. But there is no way to really identify whether these partners are actually carriers of the genetic mutation, unless the baby is born with the disease. Okay, so then only you start suspecting, or there is a family history, large family history you're having, you suspected. But today, what we do is we do few hundred cases again every month, where because of their family history, or because of prior kid who had the disease, or because of growing awareness, many of the couples are coming forward. Or even in the case of, for example, assisted reproductive techniques, which are happening, ART, the individuals or couples, partners come, they do this screening. So we screen both the partners' genome. It's a very simple test, which takes about 2 to 3 weeks time, less than about 15,000 rupees. And we identify if there are common 50% mutations in both of them. And we give them a report with clearly saying that you both have this, you have to watch out. So they have other options. You can check whether the baby has that full pregnancy, we call antenatal testing or prenatal testing. And we can always avoid these things. These are very bad. We are doing this for not for any common diseases or anything. It's purely as per the guided ACMG guidelines or global guidelines for which diseases, genes it needs to be done. It has a significant impact, especially in populations where there is a high level of consanguinity, which increases the predisposition for genetic diseases significantly. South of India and west, some parts of west of India, there is a high level of inbreeding or consanguinity that happens for social reasons. And not only that, some communities.
Yeah,
There's certain communities.
I was saying that some of the simple tests, like when you do an organ transplant, high resolution HLA typing. So this is not possible any other way other than genetic testing. So the death rate post organ transplant goes down drastically, or rejection of the organ. Then the last area which I would say that we are not doing now, but future has a lot of promise and potential for gene therapies. They've just started in the Western world. Usually it takes a little while to come to Indian markets or the developing markets. But these are miraculous cures for certain diseases, one-time treatment. Right now, it costs a few $100,000, but the person is cured for life. They're only driven by genomics.
Yeah, so tell me one thing, Mahesh, this is something when I speak to you and I'm trying to understand, I see the merit in getting a test done. I see the merits of the value that it brings in getting cure in a better, quicker, faster, more reliable manner, right? But what is it that the industry is doing to create this awareness? Because the moment you go and tell somebody that there's a test available, you must do this, the first thing that is there is suspicion that ye to paise kamane ke liye naye tarike nikal aaye. So how do we create awareness to let people know that it is in their benefit to get this kind of a test done?
Yeah. So this is exactly where Harvinder is. COVID has made a huge impact for everyone. So prior to that, many of the common man did not know what is genome sequencing. What does it do? Okay, even RT-PCR now. Last week, auto driver was talking about an RT-PCR test. So it's a significant awareness, and in many ways, it's good for the industry. This can be answered in a slightly different way. The awareness in many of the tests that we do on the illness side starts off with the healthcare practitioner. Okay. Yes, the consumer or the patient or the individual is very important. But when it comes to illness, still in India, majority of the population, first, and especially these are debilitating, these are not like a simple cough, cold stuff. They all look forward for multiple levels of clinicians and hospitals. So we started off about 7 years back. We knew this is going to be a challenge. And we created a lot of awareness, proper responsible awareness we have created, continue medical educations, RTMs, webinars, press meets, we did large conferences to adopt. Now that is one push. The second push is globally, what are the developments happening, changing in the guidelines, changing in the SOPs, how you do everything in the last year and COVID, everything together last few years have been super duper awareness across the healthcare practitioners. So in that way, I would say that for debilitating diseases, hardcore genetic diseases, the awareness, at least a part of it is solved. There are some of the things like cost. Some majority is the cost. A cancer patient at the age of 75, he has to do a 50,000 rupee test. there are multiple questions that come up. So what do I get out of this? So these are the things that we have addressed for a long time. Now coming on to the wellness side, which is much more important because it's going to be preventive. That's where I think a large responsible awareness has to be done across the country, not just by us, but media groups like you who are very, very critical in this thing, give them proper guidance, proper information. That's something that everyone has to do, including the government programs, which are very important. Well, there are healthcare priorities, but this is going to be an important priority in the next 5-6 years. So that side has to improve significantly.
So, Mahesh, when you started with the first answer, you mentioned that a lot of companies did not get into this business because of prohibitive cost or a large investment required, right? Which also means that until it becomes affordable to do this and this barrier to entry is gone, it will not be affordable for the people, right? What do you think needs to happen to create genomic testing that is accessible and affordable for the people?
I think we have come a long way in that journey. So when we started out, the test which used to cost about 70,000 rupees, 50,000 rupees, today cost about 11,000, 12,000 rupees. Still expensive for an Indian patient, Indian consumer. But these same tests are globally in US, etc., sell for about $1,500. So we have done a lot to bring these, and it's not a single answer. There are 50, 100 things we do to keep bringing the price of the tests down. For that, a large part of that cost is the reagent cost, which there was until recently a monopoly by a company called Illumina, which still is the leader. And they would set the reagent prices. So roughly 50-60% of that test cost goes to them. And that cost of sequencing is coming down. There's 4 new startups have come this year, and they have indicated that that cost might go down to almost a fifth. And companies like ours are passing on all those cost savings to the patients. So a test that costs about 11,000 rupees, 12,000 rupees might tomorrow be available for 6,000-7,000 rupees. But then it will plateau out. This is not going to be like a path lab blood test or a urine test. The large reason for that is this testing is biology aware. And that testing is largely logistics. You get a sample, you run it to the machine, you get a printout, you run it to the patient. And this will, a large part of this testing will not become that for many, many years to come. Simple tests, single genes, few mutations, there are machines coming up which will become point of care. But the way, as we had explained, there's a lot of data that needs to be analyzed in the context of clinical symptoms, in the context of population makeup, in the context of new science that is still evolving. And as we are talking, we still only understand, not even fully understand the genes. And genes are only 1.5-2% of the entire genome. So there's so much more to understand. So this industry will require ongoing evolving analytics. And for that reason, I think the pricing will stay in that range. So then once it stays in that range, what is it that can make it more affordable? 2 things, like I said, this is a once in a lifetime test. Now, a once in a lifetime test, which has value across a lifetime, lends itself very well to insurance. That's the model of insurance, right? So can insurances come up and which can underwrite this over a period of time? People take healthcare. Some of the corporates progressive corporates in India will have to take the lead in pushing the insurance companies to do that for their employees, and then the trickle down effect. Government will have to do its own part. And then the second aspect of this is that these tests will continue to be tertiary tests. People will do the cheapest test first, then the second. This is not a frontline test for cancer or any of these things. So for some time to come, that will continue. So just by default, in the funnel, a smaller number of people do these tests, and they get the value.
But is there a role that government can play to make it
Absolutely.
accessible? What is your expectation from the government?
Government has multiple areas where they can really pitch in. First of all, the area of screening before childbirth or during childbirth, a large number of kids are born with debilitating genetic diseases. And these are really bad diseases which lead to death. And once a child like this is born, the mother will never give up on the child. So that mother is out of workforce, the family is under a lot of stress. So economically, as a country, if 1 million kids are born with these kind of diseases every year, it makes all the sense in the world for government to step forward. They had come up with this program for 6,000 rupees per pregnancy. Can that be increased by another 6,000 rupees so everybody can do genetic screening before getting into a pregnancy? Yeah, and that's a one-time test for the population. Similarly, oncology care, can there be screenings that can be subsidized by the government? And as the numbers increase, test prices always come down. The numbers are that large. Third, like I was saying, that these tests are once in a lifetime. So whether it is the Ayushman Bharat program or any other program, can it amortize these tests over the 65 to 75 year lifespan of a person? For them, it's very easy. Cost of capital is low, and that can lead to wide acceptance all across.
And Mahesh, is there some estimate of the market size or the market opportunity that exists in India for genomics?
Yeah, typically now it's more, we look at it from impact/need, right? And then the market size derives out of that based on whatever pricing comes. Typically in a country like ours, about 100 million people can afford whatever anybody in Western world can afford. And since most of these tests are self-pay, those people are easily able to afford that even without government support or any other kind of assistance. And there are other kinds, not just government, there are other kinds of assistance which we also work through. There are non-profits worldwide which will pick up one disease and then they do testing for free. Pharma companies, if they have a therapy, they'll do testing for free, things like that. So if you look at the 100 million people and where genomics is going, there are 1 million births, $100 per 7,000 rupees per non-invasive prenatal testing. That leads to a very large market, right? 70 crores just for non-invasive prenatal testing per year. Screening tests, anybody who is above the age of 10 should do screening tests for cardiac. There are people dying at the age of 24 when they are on a treadmill. These things can be easily avoided. And these tests cost 3,000, 4,000 rupees. If you have 100 million people doing tests of that kind, that's a large market. So I think what is available with awareness today would be in the 100 million to 150 million. What can be with awareness across the board would be maybe 500 million to 1 billion.
Got it. So my last question is, what are the expansion plans of MedGenome?
The multiple parameters or multiple coordinates on which we are trying to expand. India and diagnostics is one of the key ones. So what we are trying to do is, like your questions were very astute. How do you make it available to people in tier 2, tier 3? How do you make it available at a lower price point? So we are looking at providing genomic tests and also other esoteric tests along with specialized path lab tests in a combination, so by which the price points come down, success rates go up, and we provide it at a quality that MedGenome is known for. Then second, since we have grown our company, like I was saying, our tests cost less than $200, where the same tests internationally cost $1,500. We are looking at expanding into this part of the world, from Africa to Southeast Asia. There are about 4 billion people in this part of the world. And for them today, genetic testing, because there can't be a MedGenome for Vietnam, there can't be a MedGenome for Nigeria, etc. So they largely send these tests to developed countries, and they are paying $1,500, $2,000. So our dream is to democratize genetic testing for this 4 billion population. And the third angle is, obviously, once we have all of this genetic insights, can we enable new therapies for diseases which are prevalent in this part of the world, not just in the Western world? So we work with pharma companies to do that. Ram, anything else to add? Of course, we are developing a lot of proprietary tests. Ram can talk to that.
Yeah.
Liquid
So one
biopsy.
thing, Mahesh, your favorite, we are expanding a lot on wellness side. So on the predictive side, the only difference is we don't want to sell anything just like that. We've been very scientific since beginning. So it will take some time for us to come up with a clear scientific evidence that what we do, whatever innovative tests that we bring in. So wellness is going to be a real one that we will look in the next 2 to 3 years, direct to consumer, so that they are empowered with their good health in their hands. So that's something that we are very keen to do.
So before I end this, there's a very interesting thought that has come into my mind, which I'm very tempted to ask you, Doctor, that when you're dealing with companies or clinicians who are sending you a requirement for this test, have they ever come back to you, or is there some information available to you that when you're looking at letting someone know that you're predisposed to this particular condition, does it actually help in taking a preventive action, or does it actually create anxiety and depression in the person?
Very
good research.
Very good question, Arvinder. So now I think I've always been bombarded with this question many times. Many people ask in business context, why can't we give the cancer predisposition to direct consumers? Okay. So every time I pause and say it's not going to be that easy. Okay. So doing the test is not easy. Delivering the report is not easy. But how you manage the expectations, how you manage the counseling part of that individual is a completely different ballgame. Okay. So today, if you are doing a cancer predictive test in US and Europe, it's a different thing. Okay, awareness is very high. They have so many options for counseling, understanding the test and everything. But in India, it's a different matter. So this is the reason why, whether it may not be a right approach in a legal context point of view, but we give every test report first to the physician and first to the clinician, number one. And the physician, clinician, nowadays, most of them understand, but still, if you don't understand, we help them to understand what it is. And accordingly, he will talk in a proper way, explain the report, pros and cons, not to panic unnecessarily. At the same time, don't ignore it in a balanced way. Second, we have a set of about 15 genetic counselors in the country who do what we call pre-test genetic counseling and post-test. You believe or not, the number of pre-test counselings have significantly increased for us because everyone wants to understand what does this test give. If I'm sending for a cancer predisposition test, just because there are several family members in that family has the cancer, so we tell, look, these are the things that you will find. Please expect this. Once you get these things, nothing to panic. We will explain you the result. You go to your clinician and talk. So in that way, many things get sorted out. But the moment you take this without proper framework, without proper infrastructure to really help the patients to understand it, and you get into direct consumer or get into wellness side, that's where the problems come. So we have to be very responsible.
Yeah. So for lifestyle diseases, there's a little bit of a different parameter and more data set available in US especially. There's a company called 23andMe, which has been doing somewhat recreational genomics, but also has been doing polygenic risk score. Will people be at risk for cardiac disease or some lifestyle disease? So they have done a large cohort. They have done millions of patient testing for millions of patients. So they have found that patients who are aware of higher risk, more often than not, and in large numbers, have better lifestyle changes, and they stick to those lifestyle changes for much longer. But again, like Dr. Ram was saying, this is for a population which is a lot more aware, well-read, etc. So if we can do the same thing with genetic counseling here, and lifestyle changes stick, instead of doing the January effect, let's go to gym and then it's all over, because of their awareness of higher risk, if they can stick to it, that'll be the service we can do.
Do you think that with the work that you guys are doing on fields like oncology, this could be the beginning of trying to find a cure for cancer?
In some
yeah.
ways, yes, because large companies like Roche, Foundation Medicine, the more and more tumors you sequence, more and more targets you get, more and more better treatments, immunotherapy. There's so many coming on one side. On another side, cancer is much more treatable, manageable if you are able to detect early, stage 1, stage 2 disease. So early detection of cancers are going to be, genomics is going to revolutionize that. It's going to be disruptive. Next 5 years, you can wait for that. So you identify individual at the stage 1 of the disease, current treatments work far better than and completely treat compared to a stage 3 or stage 4 disease. So in that way, yes.
I think cancer is one of those things that it is such a complex beast. Just like they say, death by 1,000 cuts, this will be a victory by 1,000 chips. So well, some of those chips we can provide.
Awesome. You know what? I'm pretty hopeful that, we are headed for times which are going to be healthier, not because we'll find more treatment options, but I think we'll be able to live in a society where we could be living with more of prevention, because you know what you don't need to do or what you should not be doing, because you by genetics are predisposed to a particular condition. So you could prevent that by knowing about it, and I think every player in the genomics industry is doing a wonderful job. I think it's a boon for the mankind. And it is lovely speaking to you, both Mahesh as well as Dr. Ram Prasad. Thank you so much for your time. It has been a pleasure to have you with us on Business World Healthcare.
Likewise.
Thank you very much, Harminder.